In this week's video, we discuss healthcare and capitalism. It's important to note that the economic theory and definition of capitalism might vary a little bit from the popular culture definition, and so that's something that we'll go through today. Starting with healthcare in the modern debate, we saw previously in a section on demographics and demographic change that the future of healthcare is one of the biggest political issues in the US today, and that's in part because of the aging baby boomer population reaching retirement age. So, debate on the future of healthcare primarily surrounds three options. One, our current model, which is a privatized system. Two, a single payer or government operated model. And three, a hybrid system which maintains a government run healthcare while also featuring private, external, usually more expensive options. I've also added a link, which we won't talk about here today, but for your week 6 discussion, this page sort of breaks down some of the main healthcare proposals which are floated out there today in just a little bit more detail than I'll go through in this video. So it's interesting to take a look at those, see what are the actual proposals about healthcare in US politics today. So the healthcare market does not function like a simple supply and demand market that we studied in the first module of the course. And we didn't go too deep into the assumptions of those models, but I'll detail what some of those assumptions of the model were and why they might not be actually applicable to the healthcare market. So in the standard supply and demand model, we had two interested parties. Those were buyers, consumers, and sellers, suppliers. In a healthcare market, we might have more interested parties, third parties like private insurers, governments. The general public at large often have an interest in healthcare outcomes, even if they are not currently in the market or receiving healthcare. And we talked about healthcare as a positive externality, so the general public might be interested in better healthcare even if they are not receiving it themselves. Buyers in the supply and demand model are accurate judges of their wants and needs. Consumers know exactly what their preferences are and what they can buy. But patients in the healthcare market often do not know their needs. They may not know their illness. They might not be able to evaluate the treatments. They might not know their exact preferences over potential treatments for illnesses. Buyers in the supply-demand model purchase goods and services directly from sellers, but in the healthcare market, buyers often purchase coverage from insurers who then purchase from healthcare providers or negotiate prices with healthcare providers. So once again, we have the introduction of a third party, which complicates the basic supply and demand analysis. In the supply and demand model, prices are the main coordinator of consumer and producer behavior. Given market prices, some consumers will be willing and able to purchase, some will not be. Same for suppliers. But in a healthcare market, many buyers are willing to pay pretty much any price for their lives and their health. And so rules established by insurance and healthcare providers might determine allocation of resources more than prices. Finally, the market in a supply and demand model without government intervention results in an efficient allocation of resources, except in the case of externalities. We've talked about positive and negative externalities, which result in a different socially optimal quantity than the market quantity. And this is another case of potential market failure, where generally we think the market provided amount of healthcare might actually be too low. So in light of the above points here, healthcare allocation might be inefficient, probably too low without government intervention. Right, so just a little graphic kind of describing what we went through in the last slide. Here's our typical market. We have buyers, consumers, sellers, suppliers. Buyers pay money directly to sellers and get goods and services back. But in the healthcare market, that's not necessarily true. We have our patients, the consumers of healthcare, but they are bound by financing rules and insurance rules to insurers. So patients pay the insurers. Insurers negotiate with providers about payments and costs, And then finally, healthcare providers give access to healthcare to patients following certain rules for healthcare access. Right, so we have a complication essentially of the supply and demand market, which results in sometimes a non optimal quantity being produced. Right, so again, going back to our externalities, we often think of healthcare as a positive externality. So take vaccines, for example. If one person vaccinates, it reduces their own chance of catching a disease, but it also reduces the chances of that person being a carrier who infects others. So individuals are more likely to consider only the private benefits, the benefits to their own selves of getting vaccinated, less likely to consider the benefits to society at large. Right, as a result, when we have positive externalities, the market quantity is too low, government intervention could potentially be warranted to produce a higher market quantity or the socially optimal quantity. Two other reasons why the quantity of free market healthcare could be too low are what we call moral hazard and adverse selection. Moral hazard means being insured could result in less careful behavior and more people getting sick or hurt, and thus more health care needed. So we have a certain amount provided. People sort of tend to exceed this amount if they are covered. We also have a problem called adverse selection, which means that if only sick people opted to purchase health insurance and healthy people do not, it would be more costly per person to provide health insurance. Because some people are healthy and feel that they don't need the health insurance, they choose not to purchase it. Therefore, the per person costs of health insurance rise. We want people to be paying into the system even when healthy, thus reducing the average costs for covering everyone. Right, so if people aren't careful because they have insurance and we need more health care, or more people should be purchasing health care than are, once again, our market quantity of health care is going to be too low or below the socially optimal level. So moving along into some key facts about healthcare in the modern era. So we see US life expectancy mostly increasing over the last 100+ years. But in the modern era, we've now found since about 2010 a leveling off of life expectancy. And I've posted here, this only goes up to maybe about 2015 or a little short of that. But in the years since 2015, life expectancy is actually decreasing for the first extended time period in US history. We had this Spanish flu period here, which decreased life expectancy for a short time before it popped back up. Here in the modern era, it seems like we've leveled off a little bit above 75 years, still, of course, much better than we were doing in the early 1900s. But life expectancy has not continued to increase and, in fact, is slightly decreasing over the last 3 to 5 years. As far as spending on healthcare, we can see that the Congressional Budget Office projects that these increases in healthcare costs as a percentage of GDP are going to grow into the future and, in fact, perhaps almost double by 2040 to 2050. So from about 5% now to over 8% into the future, depending on the measure chosen. And once again, what are the reasons for the increasing healthcare cost? Well, you have the increasing life expectancy, which has led to a very large, quote unquote, baby boomer population, which is reaching retirement age. And that's an age where people need healthcare kind of in this window. There's also some concerns about the actual costs of providing healthcare, the prices of individual medicines, technologies increasing. Right, so again, the Congressional Budget Office projecting that we will increase our spending on healthcare into the future. And so the question becomes, is the current system that we have the best and most efficient system for healthcare, or will the costs of this system quickly outpace the benefits, resulting in the need for a new or different type of healthcare system? So we can compare our healthcare system and the costs of our healthcare system to other developed nations. Here's a selection of nations which have what we call a public health care or single payer healthcare system, at least in some format or another, although it varies a little bit country to country what type of single payer system they have. In all of these countries, the government is the primary healthcare provider and payer, provides healthcare insurance to its citizens, and we can see that all of these countries currently spend a lower percent of their GDP on healthcare. Um, I guess this is all health spending, not just health care. There's a slight difference in there that we won't be too worried about. Again, just sort of depending on what measure you're using. But all health spending in the United States outpaces those of the single payer countries. And going back to this last slide, the Congressional Budget Office expects that these healthcare costs as a percentage of GDP are going to continue increasing. So once again, the modern debate relevant to politics is the United States privatized healthcare system the best and most efficient system possible for our country? Or would a single payer system or hybrid type system be better for us? We also want to think about why a single payer system seems to cost governments less as a proportion of GDP and whether that lesson would be applicable to the United States. Again, there are concerns about a population pyramid and also about the prices of individual medicines and technologies such as insulin for diabetics has been increasing very rapidly lately. Right, so certain items, certain medicines, the price is going up very quickly, and we want to know, is the privatized system able to deal with those issues? In terms of out-of-pocket spending, so if you get sick, how much of your total bill comes out of your pocket, that share is decreasing over time. So what does this graph tell us is just that over time, more people have become reliant on insurance and government for healthcare insurance. Also, we know that the costs of the uninsured who can't pay are borne by the government. So out-of-pocket spending going down. This is for a number of reasons. Perhaps more people are on health insurance, but also people who can't pay, these costs are borne by the government. There's more and more people who can't pay due to the rising costs and prices associated with healthcare. Right, so sort of shifting gears, right? These are just sort of a key overview of healthcare, and the debate about healthcare is often related, at least in popular culture, to debates about capitalism and its alternatives, especially socialism. In particular, single-payer healthcare is often defined as a type of socialism, and we'll talk about whether economically that is true or not. So here we define economically capitalism versus other market systems, socialism and communism, and the key differences in the three. Capitalism is a system in which the means of production are owned by private individuals and companies. Allocation of goods and services is determined by market prices. Private property is widespread. So socialism, to contrast, is a system in which the means of production are owned by workers. Workers control the companies rather than companies being privately owned or owned by individuals. Allocation of goods and services is still determined by market prices and sometimes with some government intervention, but not by a command system. Government doesn't generally directly control prices and quantities in socialist markets. Private property is widespread. So the key distinction economically between capitalism and socialism is the ownership of the means of production. In a capitalist market, the ownership of means of production is owned by firms, private individuals, whereas in socialism, the means of production are worker-owned. We actually have a socialist institution in the city of Fort Collins, which is New Belgium Brewery, one of the largest microbreweries and fastest growing microbreweries in the United States, is entirely worker owned, and therefore economically it is a socialist institution. Now, of course, it's important to note that these economic definitions of capitalism and socialism might slightly vary from the popular culture or political definitions. Again, economically, socialism simply means worker ownership. There's also an alternative, command communism, which is a system in which the means of production are owned by a central government, and the central government determines the allocation of goods and services. Right. So once again, that's a major contrast. Communism and socialism are not the same thing economically. In fact, they are nowhere close to being the same thing economically. Socialism is a market system in which the markets are owned and operated by workers. Communism is a non-market system in which production is determined by the government. Private property might exist under some forms of command communism, and it might not in other forms of command communism. Right, so private property isn't itself the determinant of these market systems. It is the ownership of the means of production. In capitalism, firms own the means of production. In socialism, workers own the means of production. In communism or command economies, governments own the means of production. Right, again, this is important to the debate about healthcare and economics because there is some overlap between government ownership and running of these certain industries and markets. And so the debate is, do we want a more capitalist type of healthcare market system, or is it okay for healthcare to be run on a command type system? So most economists agree that capitalism is the most efficient system for managing the distribution of goods and services, and the so-called champions of capitalism argument is that capitalism has directly caused improvements in living standards, economic growth over time. More production has led to more income, and this has occurred in a different way in capitalist countries than countries which have more of a command or government operated system. There have been some loose attempts historically at socialism or worker ownership, but that is not the USSR or communist Russia that we would think of. Again, economic socialism is much different, worker ownership, and so there's some interesting case studies of economic socialism to study. For now, we're mostly going to discuss a capitalist market system of healthcare versus a system of central government authority, a command system of market healthcare. Right, so why does capitalism lead to economic growth? Well, it produces improvements in technology. Private firms have incentive to improve technology and expand profits. And for the same reason, expansion of profits, we get specialization, which back in the first unit, we talked a little bit about why would specialization lead to economic growth. And to recall, people get better at what they do. That's learning by doing. They get specialized knowledge on that task. People are able to specialize and produce things that they're good at. So we might have differences of ability. And as we scale up production, produce more and more, it might become cheaper on average to do it. So a few reasons why specialization lead to economic growth and why this type of economic growth produced within capitalism seems to exceed other market systems. A case study to emphasize this point is East versus West Germany. Of course, they are now re-merged into just one Germany, but during the Soviet Union era, East Germany split off and became a command economy. And the East German Communist Party projected in 1958 that their GDP or production would exceed capitalist West Germany. However, this was not the case. We can see that here blue is West Germany and this purple one is East Germany, somewhat relatively close together in 1950. However, those two paths sort of diverged in the years where East German was a communist command economy. The communist party in East Germany was able to produce some economic growth here. We see this is increasing, but it was surpassed, that amount of economic growth in this time period was surpassed by some countries like Spain and Japan, which started below East Germany. And also, by the time we get to the fall of the Berlin Wall in 1989 here, the GDP per capita of East Germany is only a little more than half that of West Germany. Right, so again, this is a common case study to indicate that uh, capitalism is indeed the most productive method of governing goods and services and the allocation of resources. The question then shifts to, should all markets be capitalism? Should all markets be left ungoverned? And so on. Right, so some weaknesses associated with capitalism. In the previous slide, we argued that capitalism historically produced economic growth at a rate unmatched by command economies. And so in light of this fact, we have to revisit the question from module 2 or 3 discussion, which is GDP per capita an accurate measure of well-being? It seems to be the case historically that capitalist institutions produce higher GDP per capita. So how important is that to us? Well, we know that GDP per capita does not measure such issues as environmental impact and sustainability, which we'll look at in the next module. It also doesn't really measure economic inequality or economic freedoms. And so these are questions that we have to consider, especially in light of healthcare. If healthcare is left to be a fully market system where allocation of resources is determined only by prices, it could produce some inequality in healthcare and healthcare coverage. And so the question is, sometimes, are we willing to accept more production, more productivity at the cost of inequality? Or would we rather have perhaps a more egalitarian or more equal distribution, potentially at the cost of optimal productivity? There's also some concerns about capitalism as a power dynamic. Now we're starting to get into topics that we would see a little bit more in like a economic history type of class, but there are some backward-looking economic theories that say historically those in charge of creating and regulating capitalist type institutions could do so in a way which perpetuates a power imbalance. So there's concerns over a power struggle between sort of an ownership and working class. And some theorists argue that capitalism is no more than a perpetuation of slavery. It's like feudalism, where you have kind of a landowners and poor serf class. The argument is that the working class under capitalism is required to sell their labor power for survival, and by and large has no means for improving their living standards via education or gains to skills. Now, of course, the champions of capitalism argument would combat that statement in saying that that's not actually true. People do have opportunities to improve skills, improve their economic circumstances. And so the debate is, who has the ability to improve their economic circumstances? Are these opportunities to improve living standards equally available to everybody? Should they be? These are the debates surrounding capitalism versus its alternatives. All right, so what about the alternatives? Again, historical evidence suggests that capitalist economies outperform command economies. What about socialism? Again, not the same economically as communism. Communism means government ownership. Socialism means worker ownership. But then the question is, if there were to be socialist institutions, how would they work and operate? So how would we shift this power dynamic from a system where the means of production are owned by companies to a system where the means of production are operated by workers? Seems like there would have to be some sort of government intervention or involvement, right? So how much government intervention and involvement would there be, and how would that shift work, right? Are companies and individuals likely to give up their ownership of the means of production in favor of the workers? Probably not. So there's going to be some sort of friction there. There's also some concerns about the tendency for socialist systems to degenerate into authoritarianism because you need some sort of government involvement or government enforcement of the workers' rights and the workers' desires. There's some concerns that the central government may get too powerful and ultimately just trend towards a command economy. And one such example of that would be the Republic of Yugoslavia, which was actually not Soviet. It was a socialist, worker-owned approach, but ultimately sort of degenerated into authoritarianism. And so it's an interesting case study, something that you could potentially write about as a writing assignment topic if you're interested in that sort of thing moving forward. All right, ultimately, most debates, most political debates in the present day do not really seem to surround worker ownership versus private ownership. Rather, they seem to surround rates of taxation. And it's important to note that taxation is a feature which is consistent with capitalist economies, and it might occur in alternatives as well. You could have tax in socialism and command economies. But taxation is consistent with capitalism, and in fact, if you go into a macroeconomics class on the use of taxation, economic theory suggests that taxation is actually a very important economic policy tool. So modern debates, again, tend to surround the rate of taxation and the optimal taxation a little bit more than the actual ownership of the means of production. So as a result, these political types of debate seem to deviate from economic definitions of capitalism and socialism. Again, this debate about taxation tends to sort of get wrapped up in debates about socialism, but economically, socialism means worker ownership, and so that's sort of a different concept than taxation. Most modern political debates among economists regard how much we want to tax within our current system, which is primarily a capitalist market system. Right, again, the debate about taxation, important wrapping back to our original points about healthcare, because in the current system or in an alternative healthcare system, we'll need funding for healthcare. So the question is, do you fund healthcare privately? You have individuals who pay into an insurance system, or do you tax and use the taxation to fund a single payer or public healthcare system? Once again, I encourage you to go back in and take a look at the page that describes these healthcare policies. Think about which makes sense to you, which don't make sense to you, which you would be in support of and not. Right, that's the end of this video. I'll put out a study guide for our third content quiz later in the week. Good luck and let me know if you have any questions.